Good morning, good afternoon, and good evening. My name is Grace Krauser, and I'm a Program Officer for IDEAL. Welcome to the Food Security COVID-19 Learning event and today's panel on examining the trajectory of localization during COVID-19. Before we begin, I would like to encourage all attendees to introduce themselves in the chat box. We would love to know your name and where you're calling in from. We'd also like everyone to be aware that we will be providing French and Spanish interpretation for this session. If you'd like to follow the event in French or Spanish, you will need to click the small globe at the bottom of your Zoom screen where it says Interpretation, and then select either French or Spanish. Once you've selected your language, you can choose to mute the original audio, or you can hear it in the background at a lower volume. For English speakers, please select English as your interpretation language and mute the original audio. If you have any technical issues during the next 2 days, please send a chat message to anyone with IDEAL in their title, and we will do our best to assist you. Please note that if you have any questions during the webinar, we would like you to post your questions in the Q&A chat box located at the bottom of your Zoom panel. Kim, could you go to the next slide? Please do not include your questions in the chat box. Questions will be shared with the panelists in a Q&A document after the session. We will unfortunately not have time to answer your questions live, but again, any question listed in the Q&A box will be addressed post-event and commented on by the panelists. You can also upvote questions that you would like us to prioritize answering. Finally, it is my pleasure to introduce our moderator for this panel, Eman Ismail. Eman is the Middle East and North Africa Regional Representative and Localization Lead for the International Council of Voluntary Agencies, ICVA. Eman has over 17 years of working experience as an emergency and development professional. Her work as a Deputy Country Director for Programs at CARE International helped scale up the in-country Syria emergency response and Iraqi refugee response. Eman is a certified trainer on PSEA and leadership in humanitarian and fragile contexts. Eman has extensive experience in gender mainstreaming and protection. We are so excited to have Eman moderate for us today and to share her experience and expertise with us. At this time, I will hand over the mic to Eman to take us forward with today's agenda. Thank you.
Thank you so much, Grace, and thank you so much for all participants who made the time to join us today. It's my honor and privilege to be moderating this discussion with so valuable expertise and so esteemed panelists who bring unique and valuable perspectives to the topic. It's very timely to discuss localization, and I'll start by setting the scene with a quick introduction and talking about localization as one word with different interpretations. I truly believe when you have different interpretations, you cannot be so unified in the process to get one concrete outcomes or concrete different outcomes. So localization as a terminology needs to be contextualized and needs to be tailored to the context and needs to be also defined based on the local actors' needs, to ask them about what are their expectations, what are their needs based on their country, based on their context. So not to have certain definition imposed from outside, it should be from inside based on the needs and expectation. So when the Secretary General called for as local as possible, as international as necessarily, this actually triggered many debates and many dialogues related to the importance of having locally led humanitarian action brought to the center again, even before COVID-19. But we truly believe that COVID-19 context brought localization to the context again. And many, while in principle, there is a consensus about the importance of the role of local actors and local humanitarian action, the localization agenda has been interpreted and understood differently by actors as local level and among traditional international humanitarian organizations. So interpretations in line with the grand bargain just last week, when signatories met last week to discuss Grand Bargain 2, they agreed that effectively there is a need to strengthening the role of local actors when we talk about leadership and decision-making processes. So not only to talk about quality funding, but also to talk about meaningful participation. And there was also a discussion about the needs to strengthening the capacity of local actors through sharing learning, and not to have it as, let's say, top-down processes, talking about capacity building, but also talking about capacity strengthening and sharing the learning, because learning should have two ways, not only one way. According to ICVA, as a global NGO consortia, localization is defined as a process through which a diverse range of humanitarian actors are attempting, each in their own way, to ensure local and national actors are better engaged in the planning, delivery, and accountability of a humanitarian action, while still ensuring humanitarian needs can be met swiftly and effectively and in a principled manner. This transformative interpretation is not against international actors to be joining, but actually to reinforce the principle of complementarity partnership, where we all have shared responsibility to advance the localization agenda. Next, please. Why this discussion is very timely to talk about the impact of COVID-19. What are the lessons learned amid of COVID-19? We wish that we can talk about post-COVID, but while we are in the mid of this global pandemic, I truly believe that COVID-19 has brought localization discussion to the center, not necessarily eliminating all the challenges, but also shed light on successes and opportunities for improvement. And there are more and more realization from international actors, donors community, and local actors that there is a win-win situation whenever we build meaningful partnership and whenever we decide to create a positive change and long-lasting impact for those impacted by any crisis, pandemic, or any natural or climate change crisis. So it's win-win situation. And there is more and more focus amid of COVID-19 that there are still many challenges around or related to localization action, but also it's proven that local actors have demonstrated how they have agile leadership amid of the pandemic, how they have been also proven to be amid of among the first responders related to health response, community mobilization, and community engagement. Speaking about community engagement, we actually cannot talk about localization without focusing on the engagement with key leaders from the community, key activists, the dialogue that should be built with national governments, because also COVID-19 proven to be a government-led response. So how we can encourage community mobilization and more support community activists amid of lockdown, amid of curfew, and how we can rely on their power and on their access to create the positive change. Also, we would like to focus that localization is not only limited to emergency or global pandemic, it's a process. And it's always linked to emergency, but to push back on this, let's say, concept and focus also on the fact that localization is a process. It's linked to long-term SD goals. And there is always a venue to talk about empowering local actors, having them inviting us to their existing coordination structures rather than inviting them to come to already existing global coordination structure. And this is what we talk about it in Nexus dialogue, which is the linkages between humanitarian action and midterm and long-term sustainable development goals. So in practical speaking, again, localization is not limited to any emergency or global pandemic. It's a long-term journey where all humanitarian development actors have shared responsibilities and commitments. Next, please. To conclude my quick introduction by mentioning that at the beginning of the pandemic, where all of us struggled to find a plan for business continuity, how to scale up the emergency response, how to find an innovative way to work with local actors, with local activists in the community. We put a briefing paper. We call it Reinforce Localization in the COVID-19, with a clear, let's say, recommendation, with a clear, let's say, zooming in about certain examples from our members, from our international NGO members and local NGO members, who reported about different actions and different tactics embraced during COVID-19. And we also identified certain opportunities where we can capitalize on, related to how local actors can come unified together to be more concrete in their advocacy policy discussions, to enhance the environment and the enabling environment to increase the access for local actors in the coordination meetings, in the decision making processes, and also not to have the localization dialogue resonates only with funding. Funding is really important, but it's one part of it. But local actors is also asking for more space to be around the table when the decision is made. The global humanitarian response related to COVID-19 plan also focused on this shift from existing practice in the international humanitarian system, which is still highly dependent upon the surge of international staff, while COVID-19 context proven to have local actors as the first responders. And we also shed the light on key pillars regarding and related to localization, partnership, leadership, coordination, and complementarity. And again, funding will continue to be important, but we wanted to focus on other key pillars in which we meet certain benchmark if we focus on those pillars: partnership, leadership, and complementarity when it comes to coordination. So again, after this quick introduction, from my end, I'm so excited to present our panel of experts to share their experience and reflect on this important topic. To get us started, I'd like to introduce our diverse group of actors who have unique vantage points on this topic. First, it's my privilege to introduce Hamsatu James. Hamsatu is the program manager of Ekklesiyar from Nigeria and responsible for EYN projects. She has 6 years of experience in humanitarian and development projects, working with international and local organizations in diverse thematic areas: food security and livelihood protection, WASH, nutrition. Nice to meet you, Hamsatu. Thank you for joining us. Moving to introduce also with pleasure, Zemede Zewdie is the chief of party for USAID PHA funded multi-year emergency food security program consortium led by the Catholic Relief Services, CRS, in South Sudan. The project name is Pathways to Resilience, is designated to build resilience through multi-sectoral programs, including disaster risk reduction, livelihood diversification, WASH, nutrition, social cohesion, and protection. Thank you, Zemede, for joining us. Zemede works closely with Zenebe Tsegwa. We are excited to have them both on this panel, as they can speak to the long-standing and effective partnership between CRS and Hararghe Catholic Secretariat, or HCS. Zenebe leads the program department based in Dir Dawa, Eastern Ethiopia. He has 24 years of experience in implementing, coordinating, and managing emergency, recovery, and development projects. He participated in the design and planning processes of large-scale USAID funding programs and has worked with different donor agencies, INGOs operating in the area, such as CARE, IMC, and WFP, in addition to different work and coordination with local government offices and communities. Last but not least, it's my great pleasure to introduce Hewayo. Hewayo is the international development and humanitarian professional with experience in global health, social accountability, and humanitarian response. She is currently serves as the local systems and community governance advisor at USAID's Bureau for Humanitarian Assistance, PHA, and locally sustained, where she provides technical support for PHA's efforts to increase locally owned, locally led, and locally sustained approaches. She has previously worked for OFDA and Food for Peace, MSF, and World Vision. It's great to have you, Hewayo, with us today. Thank you so much for making the time to share your experience. And I'd like to start by directing the first question to you, Hamsatu. In your review, how has the localization evolved during COVID-19? What has been the most significant change you have seen? The floor is yours, Hamsatu.
Okay, thank you so much, Emma. It's a great using local resources and external to provide support to people in need. Localization has evolved strongly during COVID-19 through community-based organization, taking the lead in the implementation of project activities. Based on my experience working with international organizations, specifically with Save the Children International on Bureau humanitarian assistance, during the peak of COVID-19 pandemic, there was a restriction of movement within the state, which made it difficult for humanitarian actors to provide and access the field in order to get the needed support across to our beneficiaries. However, still during this period, As community-based organization, local actors, we were still able to provide the needed support in terms of food security and livelihood, and also nutrition to our beneficiary. EYN is a community-based organization. We work closely with the community members. Our staffs, volunteers are recruited from the community. And so because of that, we were able to provide all the needed interventions during the COVID-19 with support from our international partners in terms of release of funds for the smooth implementation of activities, as well as the release of personal protective equipment for staffs to protect them from contracting COVID-19. In addition, there was a paradigm shift in our nutrition programming from the routine house-to-house mark screening to family mark screening, where caregivers were trained to screen their children and record results, while our volunteers followed up on a weekly basis to ensure appropriate care for children during the period of the lockdown. Also, during this period also as local organization, we were given more responsibilities in terms of monitoring, reporting, and coordinating field activities to ensure there are no gaps in our programming. I noticed a significant change in our mode of operations, our ability as local actors to quickly adapt to changes, to the new work strategies developed with support from our international organization, and our ability to also perform effectively shows that local organizations have the ability to manage and execute a project, I would say, perfectly once they have the needed support in terms of capacity strengthening and resources from the international partners. In conclusion, once the capacity of local organization is being strengthened, they can be able to provide the needed support and to take the lead in project implementation. Thank you, and over to you, Eman.
Thank you so much, Hamsatu, for emphasizing on very important points regarding delegation, more trust, and also focusing on the changes occurred in the operational model amid of COVID-19. I'd like to move swiftly to Zemede to hear your point of view on the changes and how the localization evolved during COVID-19, and how do you think there are certain changes amid of COVID-19? Over to you.
Okay, thank you, Eman. First, I would like to mention the context during the occurrence of COVID-19. East Africa, especially Ethiopia, was was affected by several disasters: the flood hazard, conflict, drought, locust. There was a complicated disaster when this COVID-19 pandemic occurred. So that is one of the big challenging context. The second is CRS is working with a local partner. In Ethiopia alone, there are 17 to 20 local partners, and as a model, CRS is working with the local partners. For example, my colleague Zenebe, who is joining from Eastern Ethiopia, the organization is managing huge portfolio of US government funded relief and development program. So this is a general context we were in when we started, when this pandemic occurred. So in general, the relief and the development, especially the relief programs, was coordinated centrally by different organizations. Whenever there is an emergency happen, organizations deploy their staff, recruit additional staff, and deploy that to the areas where the emergency happened. But the COVID-19 pandemic created a different scenario because that deployment from the central place were not possible because of various restrictions and the imposed by the government, and also the protocol with the pandemic. So because of that, the main focus is now to use local partners. As I've said, the CRS and other organizations who are working with local partners, it was easy to support local partners and make adjustments. So the main focus was to make redirection or of the program and provide support to local partners to adjust the program and start the implementation.
Yeah.
This is one. The other big area was the UN and other international organizations increased their effort to work with the local partners. As part of localization, this COVID-19 pandemic enhanced the focus and the use of local partners. For example, the UN, there are different clusters, coordination cluster platforms who are providing support to the local partners and work closely with the local partners. The other thing which is very important is also the local partners by themselves realized their key position, their key role in bridging, the humanitarian, international organizations, UN agencies with the local community. When we say local partners, they are living with the community. They are the one, whom are approached by the community whenever there are any challenges. So when this pandemic happened and there is a limited movement from international partners to in other regular ways, our partner recognized, their critical role in bridging that gap and played a very critical role in redirecting and implementing the programs with the support of CRS and other partners, of course, with also the approval of the donors. The other very interesting area is the innovative approaches, the use of technology. In the past, there were limited use of, for example, electronic cash transfer mechanism. But now, during this COVID-19 pandemic, CRS and other partners expanded the use of this technology in different parts of the country. It was very successful, both electronic cash transfer as well as the use of financial service providers. The other important point, 2 points which I want to mention is, one is the attention given to the community-based organizations.
Zemede, I'm sorry, I hate to interrupt you, but we would love to hear more examples from you following other questions. And what you have just mentioned about innovative way in the working on the ground, this is extremely important. And also counting more on individuals, on community members to increase their access to focus on activities is extremely important. Sorry to interrupt you again, but we would like also to hear from you more on different set of questions. If you allow me to hear from your colleague, actually, Zenebe, we would like also to hear from Zenebe about the experience from CRS and HCS partnership. The floor is yours, Zenebe.
Okay, thank you.
Thank you.
Thank you, Eman. Before I start, I would like to ask for apology to put my video off so that I can have, better internet connectivity.
No worries.
I thank also Zemede for his tip in introducing CRS and HCS partnership. Well, as you put it, I would like to start. My point is talking about the experience from CRS and HCS partnership perspective. The history of CRS and HCS partnership began since 1987 through emergency food support in response to the famine, in fact, that took place in the country, and then followed by supports to recovery and development programs. Coming to the point, localization has evolved, during the COVID-19 through allocating funds to mitigate the effect of locust, as Zemede explained. In fact, that helped us, to provide different crop seeds so that the farmers can replant, the farm on their farmlands. Next, provision of logistics support from CRA side for field trip, so that to accommodate limited number of employees against the COVID-19. Provision of different protective materials such as jerrycan, mask, sanitizer, and the like. Facilitating awareness creation sessions to employees, government staff, and the community. And plus arranging training sessions and public gatherings with limited number of participants, keeping the COVID-19 protocols such as body distancing, hand washing, and the use of masks and sanitizers. When I come, the most significant change I have seen so far are timely information sharing among partners, particularly government and the NGOs working in the area, proactive response to our demands from CRA side, the practice on hand washing and proper hygiene and sanitation. These are some of the important points. Thank you. Over.
Thank you so much, Zenebe, and we would love to hear more from you about the different examples, the different lessons learned soon. But now moving to who are you? Last but not least, to hear from you about your observations from the BHA angle. Over to you, who are you?
Sure, thank you, Eman. I think from where I sit, what's interesting is just to note that inevitably localization and this relying on local actors always happens in a crisis. It's not just during COVID, but in a natural disaster when we rely on Red Cross, Red Crescent chapters and other actors on the ground, or whether responding to the HIV/AIDS epidemic and where you have to work through local clinics and community health workers, it is always the community level where the response happens. So localization during COVID, it's not a new phenomenon. I think what is different, other than both the time horizon and the scale of places affected, another thing that I think it's different is that there's now a global appreciation and global awareness of the importance of a community's local actors. In every country, people are realizing how frontline workers are essential, how their local governments are essential, how the work between all of these local actors are essential, and they see very starkly when their own local system is functioning well versus not functioning well. So people are really understanding this internationally at a very personal level. So I think it's really important for us to leverage this momentum on this global awareness on the importance of local actors that COVID-19 has caused. And we really need to keep this in mind in the localization conversation, because people around the world are going to be able to relate to this much better right now. So that's one of the major significant differences I've seen with this crisis vis-a-vis some of the other ones we've seen.
Thank you so much. How are you? What you mentioned about, again, bringing the localization into the center with so much focus on, again, the benefits. Again, it's a win-win partnership rather than to make it like a turning point or a new emerging trendy topic and then can be disappear later on. So it's, again, it's a journey, it's shared responsibility with all partners. Thank you. Going back to you, Zemede, I would like to hear from you about the lessons are emerging for you on how to enhance localization. What do you find to be the most important thing as a lessons to advance the localization? Zemede, the floor is yours.
Okay, yeah, thank you, Eman. One of the very important lesson is work as a consortium. both international and the local, engaging, local and international partner as a consortium is, I think, a critical area in terms of building the capacity of local partner, as well as also for international partner to reach the grassroots level implementation. So that consortium approach is one. The other is local recruitment. There is, nowadays there is huge youth unemployment in East Africa and Ethiopia. So for that, engaging the youth in the different local partners and supporting that local recruitment is seen as one big lesson. The other thing is, of course, the investing on local partners. The other is we found as a sustainable way of ensuring response at grassroots level. So there are a few of the lessons which I can mention. Thank you.
Thank you so much, Zemede, for concluding by asking for more investment on local actors and linking this to sustainable, long-lasting impact. Because again, investing on local staff, local actors would be linked to sustainability. Thank you. Moving swiftly to you, Zenebe, to share also your views on the lessons emerging on how to enhance localization.
Thank you, Eman. Well, from my side, the lessons emerging to enhance localization are a strong coordination and collaboration among local partners, which refers to government, community, and other NGOs, in fact, with shared responsibilities, timely information sharing, practicing contingency resource planning, which basically include mobilizing local resources, strengthening early warning system, for instance, the case of locust, ensuring community participation, and above all, promoting local solutions for local problems. Well, with that, the most important things that I would like to suggest are securing and channeling available funds to implementing partners and local actors in time, capacity strengthening, complementarity and risk sharing, collective or joint advocacy, associated sectoral plan. That means, the plan which is going to be prepared among different sectors, minimizing duplication of resource and effort. These are the points, that I would like to mention. Over.
Thank you so much, Zenebe, for your points about effective coordination, the needs to invest more on capacity strengthening, and also have the attitude of sharing the risk rather than shifting the risk. Moving to you, Hamsatu, would like to hear from you about the lessons emerging on how to enhance localization.
Okay, thank you so much, Eman, for this question. To me, the lessons emerging on how to enhance localization is to build a strong network for local actors. Based on my experience working in Northeast Nigeria, I noticed international organizations are well coordinated. They have INGO forum where they meet to discuss, share experience on relevant issues and programming, while in the case of local organization, there is no such network. So to me, local actors need to be well coordinated. There is need to have a strong network where the local actors can meet to learn from each other, to share experience, and also during these meetings, they will be able to help each other to develop strategies on how the local partners can be able to access funding from donors and international organizations through support and collaboration from the international partners. More responsibility should be given to the local partners. This will help the international organization to assess the capacity of the local organization and to see practically if the local partners have that capacity to be able to implement and handle projects. Thank you.
Thank you, Hamsatu. And for the time's sake, I'd like also to ask, who are you to offer thoughts from PHA angle on what are the lessons emerged and emerging for you on how to enhance localization?
Sure. I think for donors and other international actors, there's an opportunity to listen and hear back from local actors. We must create opportunities and make proactive spaces to hear back from these frontline actors who were the key to responding to COVID. And this really includes listening to local actors on their capacity needs and really broadening that definition of local actors, because we saw organizations, but also informal local groups, local government, even the private sector. You saw the companies wanting to do something to help respond to COVID in their community. So really trying to listen and understand their capacity needs and where we can do better as donors, also as INGOs, is to move away from capacity building of these local actors solely so they can deliver or implement a donor-funded program, but really to understand and cultivate them as entities in their own right that can understand the unique needs of the communities they are in and can advocate for those needs and then help deliver those services, but also help keep duty bearers accountable. So for us, the opportunity really is to listen and hear back. And that is not something we should let us slip by.
Thank you so much, Hawaii, for emphasizing on this shift in the mindset about capacity strengthening in the very traditional way, and to move away from this corner to more shift toward more open, mutual, respectful partnership, because you will listen to their needs, to their issues, and have enabling way to support them in whatever they decide that this is the most priority way, and this is our way to respond to the needs. Thank you for mentioning this. Moving to another question, and also I'm conscious about the time, I'll ask each panelist to, in 1 minute, to give one takeaway about opportunities to enhance localization. I'm truly, let's say, believe that this is a big topic, but we'll try to have it in a snapshot, considering the time. So please give 1 minute, and I'd like to ask by, let's say, I'd like to start by asking Zemede to share one takeaway about opportunity for enhancing localization that you are most excited about. Over to you, Zemede.
Is that Zenebe or Zemede?
Zemede, if you will. You don't mind.
Okay.
Zemede. Yeah.
All right. So we both are Z family. So okay. One of the, for me, the takeaway is to explore already existing experience. As I've said, there is a very good experience, non-projectized experience, as was said earlier. Some of the focus in building capacity focus on project funding, but capacity building beyond projectized funding to have that create that institutional ground. So this, I can say this is the basic. One more point is due diligence requirement sometimes from the donor is creating some influence also. That may be something which may require some consideration when you think of local partners. Over.
Thank you, Zemede, for mentioning again more flexibility from donor side, more quality funding regarding multi-years funding. This is would be and will be a strategic, let's say, and very important for local actors to create positive impact. Moving to you, Zemede, now to share your takeaway about opportunities.
Thank you, ma'am, again. Well, in our local context, there are a lot of opportunities. In fact, some of these for enhancing localization are the experience we have organizing dialogues or forums on peace building. In fact, we have this in the border area where different ethnic groups are conflicting. So that experience would help us, a lot, involving influential community members, religious leaders, women and youth in that aspect. Again, the presence of NGO forum, that would help us also. The task force meetings that we have on different sectors at zone and district levels. The practice of information sharing among local partners. I think these are also an opportunity. The donor partners' readiness for support, perhaps, though there is, resource limitation or scarcity, we are seeing, the donors' partners' readiness. Well, in this opportunity, I would like also to mention, there are some challenges in implementing those things, the limited local capacity, again, inconsistent and limited attentions, to protecting the pandemic at local government and community levels. These are some of the challenges I would like to mention, and over to you.
Thank you so much. My apologies, because also we are running against time. So I was asked to conclude and wrap up. So my apologies, because again, it wasn't easy to discuss and let's say have the time needed to also hear your final let's say recommendation. So I'd like to conclude by thanking you all. Hopefully also we can continue this dialogue in other platforms or bilaterally to learn from each other and to focus and to continue this focus on advancing the localization that again brought by COVID-19 context, but again, it's a process, it's shared responsibilities among UN agencies, INGOs, donors, and local actors who have great, let's say, proactive steps to demonstrate that they have agile leadership and they can create positive, long-lasting change to their communities. I'd like to conclude by mentioning that local actors can call on international actors and donors to have localization as organizational principle, not as operational level principle, and to get rid of the traditional, let's say, contractual partnership, but really work hard together to establish this meaningful partnership. Finally, to conclude again by thanking all who worked to organize this panel, to thank you, Hamsatu, Huwayu, Zemede, and Zenebe for sharing your perspectives and inputs in this panel. Thank you so much.